a huge independent software company which supports infrastructure management. And what's happening with infrastructure today is the infrastructure isn't any longer just an agency or a data center. It becomes almost a cloud-based infrastructure,
Right.
and that includes standards, that includes virtualization, outsourcing, and a lot of integration of agency and businesses with data and with processing and with capabilities. So what we've been doing, in addition to this focus on taking our infrastructure expertise and mapping it to where the cloud is moving, we've been heavily focused on and my particular role in the company, focusing on privacy and security and privacy technologies like identity, access management, content protection, provisioning, things like that, that would allow a very health information and exchange environment and a national health information network to use interoperable standards and to have a lot of assurance that security and privacy are being controlled. And we've done a lot of work both at the with agencies like NIH and CDC and the VA and SSA and others, but also with the hospital community, both from the micro level all the way up to the very broad infrastructure level.
Sure.
What I'm seeing in the work I do in the standards community is that this emerging infrastructure of the individual, in this case the patient, and devices, and the internet, and the access to information globally in a number of ways is changing how we view IT. IT is no longer the data center sitting in a building which has mainframe systems and printouts and so on. IT now becomes connected to the individual, to the patient, and to the provider, and to the caregiver, and the clinical outcomes become associated with a lot of information relevant to the quality of the care and to the safety of the patient prescriptions and so on. So the whole, someone said ecosystem, the whole ecosystem is being transformed by these dramatic changes in the IT infrastructure. And a big piece of that is the recognition, I think it gets to the standards discussion, working private sector, working with governmental agencies, and to some degree academia, using and exploiting the knowledge we've learned from the current IT infrastructure, the internet and the global and cloud computing and everything else, and taking that knowledge, taking those standards and applying them into the use case of the health environment. So a great benefit is this collision, basically, of this transformation of our global society, which has been enabled by the internet and all the capabilities, social networking, et cetera, bringing that to the healthcare space. And I think the great thing is that under ARRA, I think the great thing is that there's government investment to work with industry to bring these pieces together, and it's going to transform healthcare. I also think it's going to make it much more secure in the end run once we get through all the policy making and all the...
Well, it's clear.
Two focus areas. I mean, there are probably many challenges, and all the panelists have talked about them, but one big area is an area of look ahead is what I would call it. In other words, there are the health information environment is going to be operating in the global internet environment. And so the work that's going on in industry, CA Technologies, for example, is heavily involved in work around federated identity management. If you're going to have a national health information infrastructure, the identity management capabilities that are available, whether it's through private sector identity providers, through government agencies, and to other players, becomes very, very critical to ensuring trust. So building the pilots are critical, getting the policies right, but this look ahead to embed where you're going with a national health information network and the HIEs into a standards-based infrastructure that will operate in 3, 4, 5, or 10 years very successfully and very reliably and with a great deal of trust is important. I think a key factor there is what's happening now, where federal agencies are engaged with the private sector in this look-ahead advanced work to lay the foundation. We're doing some work, for example, now NIH has a a government system in place that deals with identity management. Other agencies are doing that, and I think this embedded infrastructure is really a critical challenge area, but I think we are addressing it. So I'm trying to be optimistic to say work is underway, but it's a very big area that we have to focus. And risk identification is a big piece of that. Actually, the legislation, set a marker. I mean, it basically, that plus high-tech basically said the country is serious about healthcare reform and about implementing the necessary changes, both policy, technological, practice, et cetera, that relate to improving healthcare delivery and also ultimately reducing costs. From my perspective, the privacy issue is really significant, and Tom and the others mentioned, and that an interesting outcome has been a greater attention to data privacy, both from ONC and their standards work, but also on the private sector side, working with standards groups. And we, CA Technologies and other companies, and NIST as part of this, are creating a new technical committee in the OASIS Standards Organization, which is a standards body that's very well respected and has produced a number of important standards, security assertion markup language and extensible access control markup language, to be technical, and EXPO, which is a healthcare consent and policy language profile. And this new privacy management reference management TC hadn't been moving, in terms of uptake. There was interest in it, but not a lot of, coming to terms with it. Now that the legislation has passed, what we've seen is a huge amount of interest in working to develop a model that would allow you to begin looking at how privacy is delivered, including security, including the confidentiality, et cetera, in a very complex health IT infrastructure. So an outcome has been greater focus and attention, both from industry and from government, in this type of look-ahead work, as I said when I was commenting earlier. And I think that's very, very important. Listening to everyone, taking some notes for myself, thinking, I really see four significant positive changes occurring. First of all, I'm an optimist as well. I think we're going to see we are going to see this integrated national networked health system. We're also going to see much better patient outcomes. We're going to see the clinical benefits. We're going to see the record-keeping benefits and the cost benefits, a more efficient system. But I think there are some interesting other outgrowths of this because of the nature of the beast and the complexity that we're addressing. And I think that is we're going to see new business models utilizing this infrastructure to improve patient care, to improve citizen trust, improve outcomes, improve preventative health, which we haven't had the ability to do before because of this device integration that I talked about. I think the other thing we're going to do is see much more definable and manageable risk policies and profiles. In other words, we'll have a better handle on how you manage and deliver better risk managed systems. And finally, I think you're going to see this drive a global movement towards improved health systems, because I think if you look at what's happening globally, we're seeing the same issues in the UK, we're seeing the same things happening in Europe, in the Asia-Pacific countries, and I think issues around where data stored, how it's moved, how your health records move, opportunities for improvements in healthcare are going to be global. So I think there's a global dimension.